We're absolutely committed to building the best system of care that not only supports when people need to come to hospital, but that whole notion of what healthy, vibrant communities need. They need good primary care, they need access to providers, they need to have services when they need them, and not all that needs to be done in hospital. And we're really trying to push the envelope, Lakeridge Health is on this. It isn't just about us doing it, though. It's about being good stewards, good partners, and good collaborators. So we want to be trusted by people, but that requires us to make sure that we demonstrate we can be trusted.
Welcome to Brace for Impact, the podcast sharing stories about patient care, the incredible medical professionals at Lakeridge Health, and the impact fundraising is having on our hospitals. Cindy Davis is the Chief Executive Officer of Lakeridge Health. She has 30 years of experience in healthcare, from bedside nurse to senior executive, and she joins us today on Brace for Impact, the season 2 premiere. It's so cool to have you here. Thank you.
Thank you for having me.
I am alive today literally because of you and your team, so thank you very much.
That's amazing. Well, I'm really happy for you.
Well, if you're happy, how happy do you think I am?
I know, and what I often say is I get to be the spokesperson for an amazing organization with some really talented and compassionate healthcare providers.
Yeah.
And so to hear your story is pretty amazing too.
It's got to be pretty great to go from, like, you're in charge of so many people, 9,000 people or something like that. I think you're one of the biggest employers in Durham Region, if not the biggest. And I'd love to hear about your journey, because you've been at every step of it, right? Like, going from a bedside nurse to where you are today, you've seen a lot. You've seen how every part of the sausage is made, so to speak.
Yeah, it's interesting, and we do a lot of talking about how people take career paths and how they end up in roles in our organization, and it's rarely a straight line. And so when I think back to my own early days when I started my career as a nurse, I never imagined that I would end up being the CEO of an organization. And frankly, I don't think I aspired to that. It really was about trying to provide care and service to people. And I think that has, guided me well over my career path in terms of I've tried never to lose sight in terms of why I started here. And it really was about trying to build a better place and to do the best that we can for people that we serve and for people that work in our organization.
Yeah. I'm curious specifically how you think working specifically as a bedside nurse helps you today. Like, that, I'm sure that's got to make you more compassionate. I'm sure that it has made you think less about, and I know that a hospital system is not a shareholder driven private corporation or whatever, but I'm sure it has to make your decision making a little bit more human maybe than the average CEO.
So what I would say is there's great people everywhere. And when I think about my own kind of journey and even my CEO colleagues, each of us are guided by compassion, whether you have a healthcare background or not. For me personally, I would say that because I have worked in almost every level of healthcare, from the front line and progressive management, I've had the ability to connect at every level in organizations, which is sometimes a bit unique. And it helps me with my broad perspective for sure. I've been away from the bedside for a long time, so I would never say that I'm still skilled in that, but hopefully I have an understanding of what it's taken for people to get there.
Yeah.
And certainly what it means when you show up every day at work trying to provide the best you can, whether it's direct or service care to people that come through our doors.
You talk about a lot of moving pieces. It's not just one hospital. And I think overseeing one hospital would be a Herculean task on its own. You've got like 5 hospitals. You've got 750,000 people in your catchment area. We'll talk about the Pinewood Center in a bit. You've got satellite offices all over Durham Region. I was hoping we could talk about one system, Best Health, what that means to you personally and what that means for Durham Region, the people that you're serving.
Yeah, so, throughout my background, I've worked in lots of different settings. And so I've worked in standalone hospitals, long-term care homes, and community-based settings. And I've been at Lakeridge Health for 5 years. One of the things that attracted me to Lakeridge Health was really that vision that they had, building that one system best health. And in Ontario, it's a bit unique because while there are places that have multiple sites, in Durham Region, Lakeridge Health really is the sole provider for acute care with a few minor exceptions. And we're a rapidly growing community population.
Biggest in Canada, fastest growing community in Canada.
Yeah, and so this morning I was in Clarington, and Clarington is also within Durham Region, the fastest growing in Durham. So there's a lot happening. And what Lakeridge is trying to do is really think about how we can provide support and care, not only when people come to hospital, but also in terms of just building healthy, vibrant communities. And we've done so much in terms of growing that continuum of care and expanding our work outside of hospitals. And it really is guided by that piece around building one system best health. And what does it mean? It means for a multi-site organization. So we have 5 hospitals, a long-term care home, a standalone surgical center, and over 30 community-based sites, and more to come in terms of our future. What we say is we really want to connect all those pieces together for the residents of Durham so that you know where you go, and there's an expectation of when you come through our doors that we're going to help provide that coordination of care and service. And healthcare is challenged, there's no doubt about it. And the more that we can leverage this multi-site organization, we can figure out how that centers of excellence can happen, how we can avoid duplication. But at the same time, our goal not only is about one system best health, it is about helping people live their best health. So for us in Durham Region, that means we need to think about the whole level of services, where we need to expand and where some of those gaps are. So we're really excited, not only about what's happened, but what our future is as well.
How do you make some of those decisions? Because you're talking about dozens and dozens of individual sites and how everything works hand in glove and how it's this big machine, right?
Yeah.
How do you decide this is the next priority we want to work on, or this is something we're currently doing but we need to make it a little bit more efficient, or we need to serve people in a different or maybe a fuller way? How do you make those decisions?
Well, first of all, when I think about our catchment area and where we are, we need to make sure our goal is to provide care close to home. And so I say that doesn't mean that every single location is going to have the whole
Kit
gamut
and
of
caboodle,
care.
yeah.
But what it's going to mean is that we're going to make sure within the Durham catchment area that people don't have to leave for services. And it really, for us, then guides our planning. So you think about population growth. So you mentioned we're serving a catchment area of about 750,000 right now. We know our population is expected to double over the next 20 years.
Damn.
But what's interesting about the population is it's changing. So the growth is actually coming from newcomers to Canada. And so we have to think about Durham growing in terms of diversity.
Sure.
And the importance of inclusion, diversity, equity, accessibility, and anti-racism is one of the things that guides our work.
Yeah.
The other piece for that growth is within the growth that we're going to see, we're actually going to see the biggest growth take place in people over the age of 65.
Right. Which in a sense is good because it means that life expectancy is increasing, people are living longer, and you have a huge part of that because you're trying to keep people healthier.
Yeah, but what it requires us to think about planning and shifting a bit different. So as you age, you have the potential to live with more chronic diseases. And as you said, people are living longer, thankfully. Treatments and diagnosis have gotten much better. But we need to plan for that aging population and what it's going to mean in terms of management of chronic diseases like heart disease
Yeah.
and lung disease and cancers. And so all of those things are part of what goes into what I would describe as kind of the background information that helps us plan for the future. So we look at the demographics, we look at who's going to be there, we look at where we have services right now and potentially where we don't have services. And our ultimate goal is that We want to be the place of choice, not only for employment, but also for care for people that live in this region, not just by geography, but by the choice that they know what to expect and a high level of quality care and service. And that's our ultimate goal for us at Lakeridge.
You talked about making sure that you're not just people's choice because, well, you're here, but also you've got the services that they can use. And it was so cool a couple of years ago when the Durham Region Cancer Center got a PET CT scanner.
Yes.
And I had to make so many trips. Not that I'm bitter, not that I'm, resentful or whatever, but it would have saved a lot of time. And it's so cool now that people are more likely to get screened. It means that people are more likely to make their appointments. And it also means maybe, you don't have access to childcare, for instance. And I was really fortunate. My parents were retired when I got sick and they were able to take my daughter. But my wife and I were both working at the time. I worked all throughout my cancer treatment. And it would have been a lot more difficult to get into the city. So the fact that I live a 7-minute drive away from the hospital, for instance, means people in Durham Region they can expect, I think it's reasonable to expect better healthcare outcomes when you're able to serve people better.
Yeah, I mean, so the cancer program is one of the flagship programs at Lakeridge Health, and it actually serves a population beyond Durham Region. So in the Central East, we provide cancer treatment and therapies. So beyond kind of what you would normally consider for Durham catchment. And we're quite fortunate at Lakeridge Health. We are supported by 4 foundations. They work in partnership with us and our local communities to really think about what is that advanced technology and equipment that can support care to close to home. And you mentioned the PET CT scanner through our Lakeridge Health Foundation that supports Oshawa and Whitby. We brought to the cancer program robotic surgery.
The Da Vinci robots, those are so cool.
And a PET CT. And the way you described it, before that happened, people in Durham Region, if they needed to have a PET CT, they would have had to go to Ottawa or Toronto.
Yeah. That's a schlep.
And while it doesn't necessarily seem like a long distance in terms of kilometers, when somebody is going through a cancer diagnosis and treatment, it really is another level of burden and stress that gets put on what you described, the individual and potentially their partners or care system. And we're just so grateful that that service is now available in Durham Region. And I think about, the foundation in Bowmanville and Port Perry and Ajax, Pickering. Every one of them are helping us bring the latest, greatest technology and equipment to Durham and to the system of Lakeridge Health. But it's also a really important piece for recruitment and retention of talent. And I remember I was out at a fundraiser, actually our joint bike ride, and I had an opportunity to be bike riding next to a surgeon, and I said, "Oh, hi," and how did you end up at Lakeridge? And I came because of robotic surgery.
Wow.
We know that Durham is a really great place to live and work. And the more that we advance what we can provide within healthcare, we can attract top talent to want to come and work here. And in the end, that benefits the entire community. So, oftentimes in the fundraising side, when people think about what they give and what it means for us as an organization, it means more broader impact at the community level for these people that are coming, many of whom decide to live in Durham Region, to put down roots and start their families or bring their families with them. And all of that helps with the vibrancy of our community.
Well, and also the fact that people can see, donors can see, whether it's individuals, whether it's corporations, they can see, oh, like some of the money we donated went to that. And I know that Durham, the Lakeridge Health Foundation is unique in that sometimes you can tick a box that says, I want my money to go specifically towards the cancer center, for instance, or a few other options. But to be able to see that you as a donor, like you're making an individual impact, that's so cool.
Yeah, the impact is tremendous. And, we talk a lot sometimes about the things that we're fundraising for, but the impact is really important. And again, all of this is guided by how can we do the best for the community we serve. not only in terms of treatment, but when we think about prevention and some of the work that we can do in that space. I just think about one of the great initiatives that happened with our partnership with Queen's University.
Mm,
So 3 years ago, we were fortunate enough to start a new family medicine program with Queen's University at Lakeridge Health, the first of its kind in Canada. And so sometimes you think about big complex problems, and for sure, access to primary care is one of those. But this was a ready-made solution for us in Durham Region, and just through our partnership, through all of the support, even of the foundations and our community on this, we're now in year 3. We at year 6 we'll be at full capacity of 120 people training to become family
that's so
doctors.
cool.
Yeah.
Which, if you talk to a lot of people who have family doctors, it's like, well, how did you get one of those? And you had to get a referral from a friend who got it from a friend. And so it's really cool that we're going to have more primary healthcare touch points for people.
Well, and so you think about the impact on the community as well. These are people that will be with us for 6 years of medical training and education. From 1 month into the program, they're actually embedded and started to learn what it means to become a family physician.
And they
For
fall in love with the community,
Well,
right?
and that's it. I mean, they're at a stage in their life that if we can talk about that system of care, what we're trying to build, healthy, vibrant communities,
Wine and dine them a little bit, so to
yeah,
speak.
all of those things are going to help in terms of hopefully they'll make the decision that they want to put down a home in Durham Region and want to be part of Lakeridge Health in the broader community.
Speaking of awareness, you've had this amazing campaign. This is Lakeridge Health. What does that campaign mean to you? Like when you say this is Lakeridge Health, and that could be you're giving a tour of the facilities, you're speaking in front of a crowd of people. When you say that, what is the first thing that comes to mind for you?
What comes to mind for me is really that system of integrated care that we're trying to build. And so if you think about how Lakeridge Health has evolved, it has been through, the growth of hospitals and facilities coming together. Many times when you ask people in the community what is Lakeridge Health, they'll refer to a specific hospital or a specific location. And this is really awareness campaign is we're so much more than a hospital. We consider ourselves a system of integrated care. And we've talked already about the number and the depth and breadth of sites that we have. But within that, I also want to say it's more than bricks and mortar. It really is about the impact that our skilled professionals
Yeah.
are bringing every day.
I'm literally a testament
Yeah.
to that, right? The fact that I'm still here, That's your
Yeah.
team.
And so this is Lakeridge Health really is about less focus on the sites and the bricks and mortar and more focus on the impact. So we've been highlighting some significant programs that we have at Lakeridge Health. We've talked about cancer. We've been highlighting surgery, mental health and addictions, women's and children's, and we're going to continue to do that. And it really is to showcase the tremendous care service delivery that we have, and to also, I think, get our community connected. What's available? There's a lot available at Lakeridge Health. Where we don't have services are on some of those highly specialized cardiac, neurosurgery, trauma. But many of the things are available close to home. And as I said before, we really want people to choose us, to come, stay in your community, and let us actually care for you and your families.
Well, and maybe you're not a newcomer. Maybe you've been here. I grew up in Durham Region. I went to high school in Whitby. And when I was a kid, Whitby in particular, I think had 50 or 60,000 people. And I'm curious how many people might not be aware of how big the community, number one, has grown. We've talked about 750,000. It's going to double in the next 20 years. I think a lot of people would be shocked before they see this series or before they come into the hospital how many of these cool things are available, whether it's a PET CT scanner, whether it's you've got a full nephrology unit. We did an episode on that, the surgical robots, and they like do very cool things. They also look really cool as well. They got the lights and they look really futuristic. I think that would pleasantly surprise a lot of people.
Yeah, and so, this is Lakeridge Health really is about trying to showcase that. We've talked about, where we have dedicated programs and services. And for us, again, it's about putting those pieces of the puzzle together. We've got, a dedicated orthopedic program. We've got a dedicated ophthalmology program, and then the other ones that we've talked about. And as we continue to grow, we want to make sure, though, when you come to Lakeridge Health, first of all, that we can make those connections for you and that we can help navigate that care system and bring awareness to our community in terms of location of services and the depth and breadth of what we provide as well.
It's almost like you're providing, like you're a metaphorical Sherpa in a sense. People that are traversing Mount Everest could never be me. I think it's a couple $100,000. I'm not in that tax bracket yet, but how do you help people? Because it's expanding all the time, right? We're talking about dozens of sites, more to come. How do you help people navigate that? Like when I had a stem cell transplant, for instance, I had a coordinator who would was kind of like an agent in a sense, and they're wheeling and dealing, making calls on my behalf. What are the steps you've put in place to help people navigate this and not feel overwhelmed by all these services?
Well, what I would say is one of the good things is, and we have to keep this in mind, when people don't necessarily know about us, it's because they're healthy and well. So I want
Which
to,
is a good
yeah,
thing,
I want
right?
to acknowledge that. So the important thing is, though, when you do need care and service, that we're there and we're seen as a trusted partner. And so we talk about awareness campaigns, we talk about our community partnerships and how important that is. And we've heard over the years that it's really important as Lakeridge Health, as the largest provider of healthcare in the community, that we actually support and partner collaboration. So it isn't that we have to do everything, but we certainly have to be seen as trusted partners. And we've worked really hard on that so that we can integrate those care components. The other piece I would say is that we think about our future, and that future is going to come through the work that we've been doing through our planning, but also through our community consultations. We're getting ready to launch a new strategic plan, and we're going to continue to grow. So, a couple of years ago, we were actually fortunate enough to have the largest announcement related to Lakeridge Health for the continuation of a new hospital in Bowmanville, for a new hospital to be sited in Whitby, a complex continuing care post acute in Pickering. And then the other piece that I've talked about is where we have some of those service gaps for, advanced pediatrics, cardiac, that we start to think about where we can actually locate those and can we start them sooner than later. So Lakeridge Health is on a journey to grow and to continue to grow to meet our community needs. And we have to talk more about what it means to be a system of care. And that's going to be our focus in this is Lakeridge Health campaign, but also in terms of the next 5 years for us as we continue to grow. We're a big, complex organization, but we want to make sure that when you come, we provide as seamless care as possible, and that requires coordination, navigation, and what I would say most importantly is compassion for people that come to us for service.
Can you talk about the capital builds plan? What does that mean to you? What does that mean in terms of services for people? It's probably a lot of money. How we spending the money? Can we get some of that money?
So as I said, we were fortunate enough to several years ago to have an endorsement really of what I would say not only the plan to build one system best health, but what was needed for the Durham region. And I have to thank not only our community and the people that support us at the municipal, regional, but also at the provincial level. And our infrastructure and capital plan really does talk about a lot of growth and a lot of construction. And so that's going to bring jobs and employment to the region, which is also really important. We're talking about major capital redevelopment in Durham Region for infrastructure and healthcare. That's not going to be possible without the strong support that we have from our four foundations
Some big checks.
and our community. And, we've talked about how we need to think about the local relationships and engagement, valuing and respecting the generosity of people that have given to us over the years, but also to think big and broad about the next, you know, 10 to 20 years and what it's going to mean in terms of local fundraising and how we need to work in partnership and collaboration.
What does this mean in brass tacks? Very simple terms for people. You mentioned the Bowmanville Hospital project. How is service going to increase for, let's say, the average person? Maybe you're not chronically ill, but I've got a 6-year-old, for instance. We had to
Yeah.
go to the emergency room a couple of times over the holidays because she had strep throat. So what does this mean for the average person, the capital plan over the next 20 years, let's say?
Yeah, so I'll just talk about Bowmanville for an example. Bowmanville Hospital is going to double in size. And so with that, we'll be bringing some new expanded services to Clarington in terms of more intensive care and other services to that location. The new hospital in Whitby will be brand new, net new. So it's not replacing anything we have. It's going to be in addition to what we have. But the reality is it takes a long time to build these facilities from start to finish. A new hospital takes somewhere around 10 years. So what we have to do is plan for what we currently have and how we can be, efficient, how we can maximize the most that we have within the facilities that we have. So we've done a lot of work, I would say, over the past several years around flow and access and improving our emergency departments, and we're going to continue to do that so that we can provide the best while we're waiting for these additional services to come on board. The other piece, we were really fortunate around the announcement for the post-acute facility in Pickering. So that's going to be a rehab post-acute center. It's going to give us the ability to actually support people in a better location for the care that they need. So right now, across our 5 hospitals, we may have several people that are in a hospital bed in a recovery or waiting for some other types of services. When we get this new facility built in Pickering, it'll give us more capacity within our acute care beds as well. So all of these things we describe as part of a bigger master plan. And for our general community, if you can think about it as pieces of the puzzle that we're putting together, and they all build on each other and support each other to do what we can to bring the services close to home.
We've mentioned a lot of these services. I talked about the emergency department a moment ago. You just brought it up. That, of all your accomplishments, and I'm sure you're proud of many of them, is the emergency department efficiency and the plan forward, is that one of your proudest accomplishments? What has first place for you?
If I think about how much has changed in our emergency department, I would absolutely say that's probably on the care delivery side, one of the things that I'm most proud of, but I know our team is most proud of as well. And so we often describe that the emergency department is almost like the front door of your house. You hear a lot about overcrowding in the emergency departments and long waits. And I'm not suggesting that we still don't have
Sure.
challenges at Lakeridge, but what you see is that, the front door then is a reflection of what's happening in the community.
Yeah.
So if people don't have access to primary care,
There's nowhere else to go.
nowhere to go. And so through no fault of their own, they come to the emergency department. Or maybe they work, they have a job that they can't leave during the day. Maybe they have a family doctor, but they
Yeah.
can't get access because of their job. And so we've done a lot to think about what is our partnership in the community. And when I mentioned about Queen's University, about really trying to expand that footprint of potential family doctors, our partnership through our Durham OHT with the Durham Primary Care Network, the work that's happened at the regional level associated with supporting recruitment and retention of family doctors.
It's kind of preventative in a sense
It
because
is.
you're talking about a shortage of family physicians, and that's why many people are coming to the emergency department. And you're also helping with that problem too.
Yeah, and so, when I think about the emergency department and people come, it is a point in time. And so the front end of that is what I just described. So in order for our emergency departments to function, we really need to have strong community connections and community access. So that piece of it. The other side is when you come and you need to be admitted to a hospital, we need to think about how quickly we can get you in a bed.
Right.
And so we've done tremendous amount of work in the emergency department proper. Over this past year, we've actually reduced the ambulance offload time by 73%. We've reduced the wait time in emergency departments across all four. This is the average by 26%. We're hitting so many targets on our emergency department, but we have more work to do because I know some of the listeners are going to say, well, I was at the emergency, a couple nights
Sure.
ago and
Yeah,
it's
yeah,
still
yeah.
not. And we recognize that there's peaks and valleys, but we are in such a good place. And that's been because of the support of, I would say, government in terms of the funding that we have for improvements in the emergency department. And then on the other side of that is just the whole flow within Lakeridge Health. And that was really about what are the options to try and prevent people from being admitted. When they get admitted to hospital, how we can get them connected to home or home supports or other types of assistance so that they don't need to be in hospital.
Yeah.
And all of that stuff has helped us in terms of just being able to manage the flow in and out of what I would say the house side of, Lakeridge Health in terms of inpatient activity. And then it has helped the entire flow in the emergency department. So while the emergency department is what I would say is one of our proudest moments, I think for us it speaks to the need for collaboration in the community, in the acute side of things. And the success we're seeing, we're only going to continue to grow that and gain way more momentum. Our team really is working hard together and recognizing that in order for us to be successful in one piece of care delivery, we need to work collaboratively together. And that's something like you mentioned, we have 9,000 employees and volunteers and physicians who work in our organization. Sometimes it's really easy to stay in your own kind of silo and lane. But for us, we just want to break down everything that we can to deliver the best we can. And we know that collaboration and partnership is key for that, whether it's with our community or internal within the departments that we have.
The left hand knows what the right hand's
Yeah,
doing in a sense, right?
absolutely. And so, oftentimes people will say overcrowding in is an emergency department. It's a symptom of what's happening in the community and what's happening in the hospital itself. And so you can't actually help one without helping everything. And it requires that understanding and partnership in order to solve the problems together.
What about staffing? We've talked about the number of 9,000 a couple of times. We talked about how difficult it is for some folks in Ontario to get family physicians. What about staffing practices at Lakeridge? What does the vacancy rate look like, for instance? I think you fast-tracked hiring processes, like you found efficiencies
Yes.
there. What does that look like now?
Yeah, so it's interesting because I remember when I came, I've been at Lakeridge Health for just a little over 5 years, and there was a heavy reliance on kind of outside people coming, providing
Like agency?
yeah,
Okay,
agency
yeah.
providing work at Lakeridge Health. We're more than 2 years now without any agency help.
That's amazing.
It is amazing,
And a lot more affordable.
and also what I would say is affordable, but also when you came and you did a shift, you may or may not have lived in Durham Region, you might not have been connected to the greater purpose of what we're trying to do.
Sure.
And the more that we can recruit and retain people, and hopefully people that live in the Durham region, it isn't just a connection for work. What I say is, when you think about if you live and work in Durham, the likelihood that you've cared for friends, family, neighbors, colleagues, friends, family, neighbors is pretty high.
You have more buy-in.
Yeah, and so the impact that you have is more than just showing up for the job that you do. It's an impact on your community as a whole. And I think that's what we're trying to build in terms of that purpose of commitment, and one that people see that this is my, healthcare system that really is meeting my needs. We've been really fortunate in Durham Region because of our community colleges and universities. We've reduced our vacancy rate by 44% for nurses, and that's a direct result of our colleges and universities, the support that they have for these programs, and then some of the funding sources that we've had to train students, to have the students come and work in the capacity as a student, and then ultimately our success rate for hiring them has been tremendous. So our vacancy rates are low, and we want to continue to foster those relationships and partnerships that we have with the colleges and universities that support that. The other piece that we've talked about already is that when you grow in terms of the breadth of what you provide in terms of advanced clinical services, you bring the equipment and the technology that people want in this new age that we're all in. It has the ability to attract talent. Um, and Durham is a beautiful place. And once people get here and they get to some of our communities, as you say, as a longtime resident of this region, it has grown, but it continues to be one that's embedded, I think, in a sense of community and a sense of belonging, and that's what we want to continue to foster too.
Well, and the parking is a lot better than it is downtown Toronto, right?
Yeah, and
A little bit.
well, the traffic continues to grow here, but when you're 5 minutes from home
Yeah.
and you can do, or 10 minutes, and you can do those jobs that traditionally you had to commute for, I
Sure.
think that's going to help us. And we've been quite fortunate at Lakeridge Health in terms of attracting talent. And I think as we continue to grow in terms of all of that expansion that we talked about, I think we're going to continue to be attractive for people to want to work here.
We've talked about a lot of services for physical health. I want to talk about mental health, and I'm sure you're proud of this as well. You've got one of the largest and most complex mental health facilities and programs in general in Durham Region. Can you talk about that?
Yeah, so we've always had a footprint in mental health and addictions. And I think probably again, unless you've had to access these services, you might not know the depth and breadth of who we are in this space. We have acute care services. We merged with Durham Mental Health Services, which was all community-based services more than 5 years ago. We have residential substance withdrawal centers at our Pinewood locations.
Yeah.
And so, we have acute care, we have residential substance withdrawal, and that depth and breadth is probably one of the most largest community-based mental health and addictions programs in Ontario. But we have more work to do in this space.
But it's also okay to take a minute and a half and go like, we've done a pretty good job so
We-
far, and we continue to do a good job. But you want to bask in it a little bit.
Absolutely. And so what was interesting is, we talk a lot about this, and often I'm out in the community. And today even I was talking about mental health and addictions. We have so much support at the local level, the municipal level, the regional level, to really think about what the impact is, where the gaps are in service, and what more we want to do within this space. We have ambitious plans for this program. We really want to think about how we can have dedicated urgent and emergency care that leverages all of those spaces that we currently have, but looks at a completely different model for when people arrive at our door, whether they walk in, come by ambulance, or come by police services when people come to our facilities for treatment and care. So it's one that we're really proud of, absolutely. We've got strong partnerships with people that are in this space, and I often say there is so much work to go around. And this is an area where we shouldn't be duplicating. We should really be working in partnership to leverage everything that we can to provide better care.
Yeah. Well, it gets back to the whole community-based care. Hopefully people that are working here are living here because number one, they get to experience the amazing facilities here, and number two, because they have buy-in. And that comes with physical health. I think it comes with mental health as well. And the purpose of this whole program, this whole series, is showing people the effect that their dollars have. What's your appeal to folks? Because yes, government's providing a lot of money, of course, and we're very lucky, but also the community's providing a lot of support as well. What's your appeal to people living in Durham Region in this catchment area? What's the buy-in that you want them to have?
I want them to come on this journey with us, that we're absolutely committed to building the best system of care that not only supports, when people need to come to hospital, but that whole notion of what healthy, vibrant communities need. They need good primary care. They need access to providers. They need to have services when they need them. And not all that needs to be done in hospital. And we're really trying to push the envelope, Lakeridge Health is, on this. It isn't just about us doing it, though. It's about being good stewards, good partners, and good collaborators. So we want to be trusted by people, but that requires us to make sure that we demonstrate we can be trusted.
Yeah.
And it's through that impact that we're hoping that we can have, whether it's around mental health and addiction, cancer, or other programs and services, that when you have to avail of these things, that you are that you understand you're in good hands, and that the people that are here are skilled and professional and as good as anything you can find anywhere else. And so our appeal for us, it's interesting because Lakeridge Health has grown so much, and one of our physicians recently said, when I walked in the room 20 years ago and I mentioned Lakeridge Health, probably my colleagues didn't know who we were. I do that now, and everybody knows who Lakeridge Health is. What we want Durham community to know is who is Lakeridge Health, what the breadth and depth of that is, and hopefully feel a sense of pride that we do around what we're trying to build and what we're trying to deliver.
When you wake up every day, because you've got a big job, you're managing 9,000 people, you've got 30 sites, you've got more sites coming, you're working with the government, you're working with the community. What do you look forward to every day? And I know you're going to say something like, helping the community and making sure that people get the care that they need. But can you give me like a specific example of that? Is it, your conversation with physicians in the healthcare system at Lakeridge? Is it, what is that for you?
I think I would probably go back to where we started. Who am I? And fundamentally, I think about myself as a nurse in this space. I think about myself as a mom, a partner, somebody who supports aging parents, the exact same thing that our community faces. And so what I'm really trying to do in this, and although we talk about this big complex system and all the people that work in it, I describe my job as being pretty easy.
I thought you were going to say it's being pretty, and I was like,
No.
you know what? That's not a bad job description.
Well,
How do I get that?
Well, and so I wouldn't say easy, but I would say the three things I often talk about in terms of simple things is that I need to make sure that we do the best we can for the people we serve. I need to make sure that the people that work in our organization have the best environment and the best equipment to do their job. And so when I see that on a daily basis, sometimes those things align and it comes together, I'm really proud of it. And I'm proud of the people that work in our organization. I said before, it isn't that healthcare doesn't have challenges. We do. We need to think about sustainability differently. We need to think about innovation, technology. We need to think about efficiencies in terms of how and where we provide care to get the best bang for the dollars that we have. Every day in our organization, I know that people show up wanting to do the best that they can, whether you're in the service side of our organization or you're in the direct care delivery side. And my job is really to make sure that we've got the environment for people to shine, and to do the work that they came to our organization to do, because it is more than just a place to work. It really is about the work that we do and the commitment that we have to our communities.
Cindy, we've talked about the PET CT scanner. We've talked about the surgical robots, the Da Vinci surgical robots. those are just a couple, and they're big examples, but those are just a couple examples of purchases you've made thanks to community philanthropy. What are some other examples?
So we're fortunate enough to have 4 foundations that support us. So we've talked about the Lakeridge Health Foundation. We have a foundation in Bowmanville, and they're in the middle of a capital campaign. So one of the biggest redevelopments that we'll do in the history of Lakeridge Health, as I said, that hospital is going to double in size. And so they're now out fundraising for that new hospital. Our foundation in Port Perry brought a CT scanner to Port Perry. And so that CT scanner, I remember the day that it was commissioned and we walked in the room and our chief of staff said, "This is life-changing for people in this
Literally,
community."
though, yeah.
When you show up at an emergency department, one of those diagnostic tests that you want to have rapid access to is a CT scanner now. And it means that people can get diagnosed and treated way more quickly in Port Perry. The other interesting piece about that, when I talk about that system of integrated care, it actually gave us more capacity for CT scanning across Durham Region. Because we have a central intake for CT scanning, you can say, I want to go to this location or that location, but I'm happy to go anywhere, wherever's the shortest wait. So that's what came to Port Perry. The Ajax Pickering Foundation has been tremendous in terms of the work that we've done within our long-term care, within the hospital, but also most recently the Jerry Coughlin Health and Wellness Center. And what that's meant in terms of a standalone surgical center for Pickering. And really, that place we describe as part of our future, and future in terms of care delivery. So it's enabled us to move some day procedures that we would typically do in our ORs to that location. We also have a strong partnership with primary care that's located in that building, as well as some of our education space for regional paramedics. So it really is a hub of healthcare delivery and wellness, and one that each one of these things wouldn't be possible without the hard work and dedication of our 4 foundations and really the generosity of our community. People have been generous. They continue to give to us. And, I just want to take the opportunity to say a huge thank you. We're fortunate in terms of the support that we receive, and it continues to help us grow and be stronger. We really have to demonstrate that. The proof is in what we're going to do.
Yeah.
And our commitment to that. And that's really what I hope the message would be for the people that are listening. We're committed to this. We want to serve the community, and we want to create the best environment for the people that work in our organization.
Thanks to Cindy Davis for joining us on Brace for Impact, presented by Lakeridge Health Foundation. Brace for Impact wants to give you a sneak peek behind-the-scenes look at how donor support makes all of this amazing work possible. We want to inspire and motivate you to make a difference in your own way, because it's people like you who are making a difference in this community. My name is Coulter Bouchard. Join me by giving or getting involved at braceforimpactpod.ca.